Hello, it's Dr. Greg Marion here at One Spine Chiropractic. One of the common conditions we see all the time here are pinched nerves, and we get the questions asked, what causes a pinched nerve? Pinched nerves can come from a host of things, but the number one thing we treat here regularly is bone related, which is a subluxation. That's telling us that there's a bone misaligned, putting pressure on that nerve, causing some pain and some spasm. Let's say that bone is misaligned in that lower part of the neck. A lot of times we'll get severe pain, what we know is a crick or stiff neck, but also that gets long enough, that pain will start radiating down the arm, causing sharp shooting pain, numbness, and tingling. So that's a bone-related condition causing the pinched nerve. The disc-related is the second thing we see here most often, and what we do is we specialize in spinal decompression. So when you have a bulging or herniated disc, what we see is those discs should be nice and healthy. Unfortunately, when there's inflammation or injury, that disc starts protruding out to the side. Once that disc protrudes out to the side, that's actually what causes that pinched nerve and then impingement syndrome. Same thing, depending on where it's at in the body, say the neck or the lower back, we might have some radiating pain, causing some severe sharp shooting pain, numbness, and tingling. So what we do is we offer spinal decompression for that condition to get that disc back in there healthy and happy, to avoid any surgery and any long-term effects from there. Okay. The last thing we see here is muscle spasms, nerve impingement due to impingement syndromes due to tight muscle. So what we want to do is determine where that muscle was tight, causing some spasm and pain. And what we do is we either use deep tissue massage to loosen that up for us. We have a shockwave therapy that will beat that area up gently, but more importantly, effectively, to break up some of that scar tissue, some adhesions that have been there for a long time. Another thing we might have to use is if you're really inflamed and severe pain, we have some laser therapy that will get the inflammation, some pain out in the muscle area. So another issue we see here is arthritis. That's one of the issues that we see that tells us that problem has been going on for a long time. Arthritis doesn't come from old age. Arthritis comes from the wear and tear you've done to your spine over several years. So as we see with this little mannequin here, we want nice, healthy joints, big open spaces for those nerves to come out of. And a lot of times what we see is those nerves are getting impinged due to our arthritic condition. So what we see is the wear and tear in the bones causes bone spurs, decrease of disc space, but more importantly, when there's no space for that nerve to exit out. So that's called spinal stenosis. You could have stenosis in some areas, say intervertebral foramina, causing pressure on that nerve, radiating pain down that arm, pressure in that lower back, radiating pain in that leg. Another thing of stenosis, it'd be coming from your spinal canal. So what we see is either probably coming from somewhere interior facets, but also maybe the disc spaces in between and some arthritis in there. But more importantly, if you're having any of these issues with the pinched nerve, give her also a call, because what we want to do is we want to do a thorough evaluation, maybe take some pictures to make sure we know what we're dealing with and not guess with your health. Keep you safe, but more importantly, get the relief you need and the results you want. Thank you.